Metabolic syndrome is a common cluster of conditions that contribute towards a greater risk to diseases such as heart disease, type 2 diabetes and stroke. These conditions are as follows. High blood pressure, high blood sugar content, abnormal cholesterol levels, abnormal triglyceride levels and excess body fat. The combination of these conditions will increase the likelihood of complications occurring and developing within the body. If you are susceptible or have any of these conditions, then a lifestyle change is needed in order to combat the development of any health problems.
Welcome to Simplified Health Tips, your place for factual information about achieving and maintaining optimal health. I'm Andrew. Today Michael and I will be covering everything you need to know about metabolic syndrome, including its causes, symptoms and treatment options. So, tap the like button, smash that subscribe button and let's go. What are the symptoms of metabolic syndrome?
The conditions that cause metabolic syndrome are not easily diagnosed or felt unless detected by a doctor. Noticeable signs of having these conditions is a larger waist circumference, blurred vision, increased fluid intake, increased urination and fatigue.
What are the causes of this condition?
There are two conditions that are closely linked to metabolic syndrome: obesity and inactivity. An abnormal body mass index combined with low daily calorie expenditure will lead to an unhealthy ratio of body fat to lean body mass. The excess body fat causes health complications throughout the body. Insulin resistance. The ability of your cells to absorb sugar becomes inefficient because of your cells resisting the hormone known as insulin. This causes your blood sugar levels to rise despite the body's attempt to lower blood sugar by producing more insulin.
Are there any risk factors we should be aware of?
Here are the following factors that may put you in risk in developing metabolic syndrome. Obesity. Unusual amounts of body fat present in the body. Higher body fat concentration leads to an increased likelihood of developing the disease. Other diseases. Conditions such as fatty liver disease or sleep apnea may increase the risk of developing metabolic syndrome. Age. Chances of developing metabolic syndrome increases as you age. Ethnicity. Hispanics, especially Hispanic women, have been shown to have a greater risk in developing metabolic syndrome. Diabetes. Pregnancy or a family history of type 2 diabetes may lead to the development of metabolic syndrome.
How about complications that may spring from having metabolic syndrome?
The following may be developed if you have metabolic syndrome. Heart and blood vessel disease. The buildup of plaque in the arteries, due to high cholesterol and blood pressure, will cause damage to the heart by narrowing and hardening the arteries. Type 2 diabetes. A result of insulin resistance, complacency and changing an unhealthy lifestyle will lead to your body unable to properly absorb sugar, causing high amounts of blood sugar levels which will lead to type 2 diabetes.
What steps can we take to avoid developing metabolic syndrome?
The following are general lifestyle and dietary guidelines to follow in order to prevent developing metabolic syndrome. Eating nutritionally dense foods such as fruits, whole grains, lean protein and vegetables. A habit of being physically active. Lowering sodium and saturated fat intake. Avoid smoking and constantly checking your body mass index to ensure that you are within the normal range.
How is this condition diagnosed?
The following traits are considered defining symptoms of metabolic syndrome. Elevated fasting blood sugar. An abnormally large waistline. 35 inches or more for women and 40 inches or more for men. High triglyceride levels. Low HDL cholesterol levels.
How is metabolic syndrome treated?
Your doctor might prescribe medicines to address each individual condition that are factors to the development of metabolic syndrome. A lifestyle change, in terms of diet and exercise, is highly recommended and is likely the suggestion that your doctor will give you if diagnosed with this disease.
Any recommended lifestyle changes or home remedies to aid in treating metabolic syndrome?
These are the following lifestyle changes that you can make in order to manage the conditions that may cause serious health problems. Regular physical activity. A more active lifestyle will help improve health markers. Incorporating activities into your daily life, such as opting to walk more or reducing time spent lying down or sitting down, will increase your daily calorie expenditure. Weight loss. Depending on your current BMI and body fat to lean body mass ratio, you will need to lose a certain amount of weight to reach the recommended standards. Weight reduction has been shown to decrease insulin resistance, risk of diabetes and blood pressure. Maintaining a healthy weight is also important. If you are having trouble losing weight, consult a dietitian and your doctor for options. Healthy diet. Eat more nutritionally dense food in order to give your body the needed minerals, vitamins and macronutrients to function properly, such as lean meats, whole grains, fruits and vegetables. Also avoid the following foods which have been shown to increase the severity of the conditions that cause metabolic syndrome: alcohol, sodium, sugar, high caloric beverages, fats, specifically saturated and trans fats. Stopping smoking. Cigarettes worsen the conditions that cause metabolic syndrome. Research has clearly indicated how cigarettes damage the functioning and parts of the body. Quitting smoking will greatly improve your health. If you are having any problems quitting, talk to your doctor for options that can combat nicotine addiction. Reducing or managing stress. Find a stress management technique that works for you. Activities such as meditation, yoga, exercise and the likes. Alternative medicine. Any supplements that have any proven therapeutic effects for the relief of any of the conditions related to metabolic syndrome may be used with proper coordination and consultation with your doctor.
Thank you again, Michael, for helping our viewers fully understand metabolic syndrome.
The pleasure is mine.
To our viewers, remember to share this video with someone who may benefit from the information. Also leave your feedback and topic suggestions in the comments section. See you next time.
Thank you for watching to the end of our video. If you found the information helpful, please like the video. Also, don't forget to join the family by subscribing to our channel. See you next time.